because I think there's a lot of misunderstanding about cholesterol and about heart health. And so we're talking about our path to a healthier heart, but honestly, we're talking about our path to just a healthier overall body. So my name is Abby Horton. I'm an assistant professor at CCN here at the University of Alabama. I'm a registered nurse. I'm a certified health and life coach, a Wellbama ambassador, and a wellness class educator. So you're welcome to reach out to me at abby.horton@ua.edu, and I'm happy to answer any questions, connect you to resources, or anything like that. Right before the class began, I sent Miranda the slides, and so she'll pop those in the chat toward the end of our class. So my presentation is just for educational purposes only. It doesn't constitute medical advice. And if you have specific questions or health concerns, it's really important that you contact your healthcare provider, because the things that I'm going to tell you are going to be really general, but they may change what would happen for you and your care based on your individual health needs. So just keep that in mind. So our objectives are to talk about some cardiovascular risk factors and habits that might help to reduce those, to understand the relationship between cholesterol and hypertension and how the risk factors really influence both high cholesterol and high blood pressure, and then to identify healthy habits that would help reduce those. So overall, cardiovascular disease is the number one killer of people in the world. And so when we look at the stats, it's very concerning to see that even though we talk about cancer a good bit, we've talked about COVID-19 a lot and even HIV/AIDS, cardiovascular disease, which is abbreviated CVD, actually ends up being more of an issue for most individuals. And so I think that's important just to kind of give awareness to that. And when we talk about cardiovascular disease, that's looking at heart and stroke. Really, if you've got issues going on with the heart, a lot of times if it's vascular, meaning it's about the blood flow of the heart, then that is going to be something that also impacts the brain. And it just depends on if the issue with the circulation and the blood flow is before you get to the heart, so making it more of a heart issue, or if it's between the heart and the brain. And so where those issues are is really where you end up seeing, am I going to have a heart attack with this issue, or am I going to have more like a mini stroke, a transient ischemic attack, or TIA, or I'm going to have an actual stroke. So cardiovascular health looks at the health of the heart and the blood vessels, which run throughout the body, of course. And there are a lot of factors. So having high blood pressure, having high cholesterol, using tobacco or tobacco products, nicotine, vapes, other illicit substances, that you might consider. And then having diabetes, being overweight, those are also factors that influence not only metabolic syndrome, which we talked about in the last class, but it also looks at cardiovascular disease. So Go Red for Women typically is done in the month of February. Again, kind of a play on Valentine's Day and all things related to the heart. And what a lot of people don't know, and I didn't realize this at the beginning, is that Go Red actually is an acronym for knowing your numbers, owning your lifestyle, because lifestyle habit plays a huge factor in your overall health, realizing your risk factors, educating others, so letting other people know the things that you've learned about this heart health, and then not being silent. And that means that you're not silent when you know that you're having symptoms. Even if it's just a scare, it's better to go and be seen than to, hope that things are okay and you sit at home and maybe have a cardiovascular event. So how does this all relate to cholesterol? So cholesterol and hypertension go hand in hand. And this graphic really explains it. I'm not going to go into a lot of the detail here because I think this is a graphic that you really need to kind of look at and sit with and kind of read through. But a lot of people who are admitted to the hospital with a heart attack have high cholesterol. So 54% of people. And then 62% of people who are admitted to the hospital with a heart event also have high blood pressure. And so those go hand in hand a lot of times. And hey, Miranda, could you see if everyone's muted? I'm hearing some feedback and conversations that they may not want recorded. Thank you. So cholesterol is going to be fat that circulates in the blood. So when you look at cholesterol, cholesterol is something that the body makes, and cholesterol is also something that you eat. So about 75% of the cholesterol that is made, it's actually produced by the liver. And about 25% is what comes from what we eat. Now, I don't know about you, but I have had high cholesterol readings in the past. I also happen to be having stroke level high blood pressure readings at the time. And this was at the time of my life where I was also morbidly obese. And so I was having extra fat around my middle. I was around 250 pounds. And for a 5'6" female, that is around class 2 morbid obesity. And I had high cholesterol and I had high blood pressure. And like I talked about in the class last week, looking at, metabolic syndrome and things like that, it's funny because the way that we say things to patients sometimes makes them think that things are accidents that really aren't. There's actually relationships that are established, because what we'll say sometimes in a clinic is we'll like, oh, well, I see that you're a little overweight. We can work on that. Um, let's check your blood pressure. Oh, your blood pressure's a little high today. Well, I mean, that could just be white coat syndrome. Are you nervous? Were you running in here? So it's really easy to dismiss that high blood pressure reading. And then they'll say, well, let's look at your blood work and see what your blood work says. And they're like, oh, well, funny, your cholesterol's high too. Well, it's really not funny. It's not funny, haha. And it's really not funny, ironic. And it's not funny, like, oh, I wonder why that happens. It's just, I think, something that we say, that colloquial language that we say sometimes in passing with people, because there's a real relationship. When we have extra adipose tissue or fat tissue on board and it's around our vital organs, so, having body fat that is more in your core, in your abdomen, in your chest, which is where I tend to have my weight. It's kind of that apple figure, if y'all remember from the 90s, where you're like, are you an apple or are you a pear? And apples tend to have more of that core adipose tissue or fat tissue around the center of their body. In that situation, I'm definitely an apple. And then the folks that are more pear-shaped, and these are kind of outdated terms, but I feel like probably a lot of you guys can relate to this, because we were all like, are we apples or pears? The people who are pears have more weight in kind of their lower area, their thighs and their hips and their buttocks and that sort of thing. Maybe their legs. And the people who have pear shapes and store their body fat, their adipose tissue, same thing. Adipose tissue just sounds nicer, I think, than saying fat tissue. That adipose tissue on the bottom, those folks who are pears tend to have better outcomes because it's not building that fat tissue around the organs in the body. So it's not visceral fat, meaning that it's wrapped around those organs. It's not putting pressure or crowding those organs. So it's not impacting how well they're functioning in that sense. From like the sense of, there's a kind of an anatomical, pressure or something structural that's going on there. Certainly, if you have extra weight anywhere on the body is going to be working harder. The heart's going to have to work harder to pump blood to where it needs to go, etc. But it's a different kind of hard. And so we talk a lot about cholesterol. Oh my goodness, like we've made eggs evil, right? But the thing is that if your cholesterol is high, there's something else going on besides you're just eating too much in terms of cholesterol-rich foods, like some cheeses and meats and eggs and milk and things. You're probably, most likely, I would guess, you're not probably consuming so much of that's causing a problem. It's probably just tipping you over to be in the problematic zone. But it probably means that your baseline, something is going on with your liver, something is going on with your inflammation or your overall health that's putting you really in that zone of being concerned. So the blood pressure then, when you have too much cholesterol, if it doesn't get used up, what happens is that cholesterol gets deposited as these little yellow kind of images here within these blood vessels. And then as it gets narrower and narrower, it gets harder for the blood to go through. So then the blood pressure is like the blood in the vessel is like water in a hose pipe, right? Like if we don't clean our hose pipes and store them and we leave water in them and it gets really cold this winter and then we come back in the spring on spring break and we're like, oh, let me get my water hose out and let's, water something in the yard when we have a minute, then you can get some corrosion and you can get some rust in that because you let water sit in it for these months. Okay. Well, then if you get a kink in that hose or you get too much buildup, too much, corrosion in that water pipe, the pressure, you have to really wrench down on that and the spigot and get that pressure turned up real high to get the water out, right? Okay, same thing happens with the heart. It's that spigot that's having to work real hard to get that pressure out so that the blood is moving where it needs to go, because the corrosion in this example is the cholesterol deposits. Because if the cholesterol doesn't get used up by the body and it can't get recycled by the liver, then it gets deposited into those vessels and it causes that narrowing. And that's where you can have plaques build up, plaques that rupture, kind of like a zip popping. And that's where you start having things like, um, heart attacks, strokes, those kinds of issues. So most people don't know they have high blood pressure. We say that that's the silent killer, but I actually think that the silent killer in this situation is the cholesterol, because it usually comes first. Now, there are other reasons why you would have high blood pressure, but in terms of, pretty typical reasons why you have high blood pressure, it's related to cholesterol in a lot of times, in a lot of scenarios, and it's because of those deposits. And so cholesterol really has no symptoms. We say that high blood pressure doesn't or hypertension doesn't, but the thing is that you're going to feel tired. You might feel like you've got cotton in your eyes. You might get a lot of eye strain or eye pressure. You can get headaches. You can feel really fatigued. So high blood pressure does actually have symptoms. That's kind of a misnomer. I don't know why we say that in medical communities. But what the thing is that you don't, those are so vague that you don't attribute it to the high blood pressure. Now, when you go, then you happen to find out that your cholesterol is high. The cholesterol probably was high first and led to the high blood pressure. I can't see the chat because of the view that I'm in with the new update, but I want y'all to put in the chat a 1 if this is new information for you, and if it's helpful, feel free to put a comment and we'll let Miranda tell us about it. So Miranda, just interrupt me when you see some coming in. So cholesterol isn't bad. We talk about cholesterol being bad, and it isn't. It's something that we have to have, actually. It is what we need for our cells and our bodies to work. So it actually helps our hormone synthesis. So it makes our hormones be able to form and work properly. It helps with our vitamin D production and other normal body functions. But we make it sound like LDL, which in nursing school we teach it as lousy, the lousy LDL, and HDL as the healthy LDL, or the helper HDL is what we think. So we think, oh, HDL is good and LDL is bad, and then we've got our red blood cells, which is helping us move all of this. All wins is helpful. Oh, good. I'm so glad. Any comments, Miranda?
Very helpful.
Good.
Lots of them. Yes, very helpful and very helpful. So
Good. I don't like to get really medical with it because I feel like if we can explain anything to a 5-year-old, which is how I explain this to my kids, then then it makes sense for all of us, all of the adults included. I like for things to be broken down in this way. So LDL is not evil and HDL is not the angel here, which is how it's depicted. But the thing is that it helps nursing students and medical students understand the difference because they've got a lot of information to learn. But we're never really supposed to then go and teach the public or our patients in that way, right? Because y'all don't need to hear it in that way. We need to know it like this so that we can remember it, like, which is the good one. Oh yeah, but like we have more information than we ever tell people because it's too much, right? It would be too much to share. But then when y'all hear that, like, oh my goodness, the LDL is bad. Well, no, it's necessary. But too much LDL is not helpful, right? Too much LDL gets deposited and becomes plaques and narrows your vessels. But do you need LDL? 1,000%, yes, you do. The thing is that the ratio, meaning how many LDLs to how many HDLs, y'all remember that from like ninth grade math class, the ratio is really important because if you have a lot of LDL that doesn't get used by the body and you need to get it back to the liver, it's kind of like Pac-Man, that goes and gobbles things up. The HDL works like Pac-Man and it goes and gobbles up the LDL that's not being used by the body, takes it back as like a little transporter back to the liver to be used. So the thing is you even can have a normal range of LDL, but if you have low HDL, which is very common, especially in women, then you don't even with a perfect LDL, you don't have enough HDL to then go and do its job. So then you can get too much LDL in the bloodstream, and that's when it becomes problematic. So what's LDL used for? It is used for all of these hormonal productions, vitamin productions, all of this. And vitamin D, is not just a supplement. It's not just something we get from the sun. It's also got a hormonal component. So that's kind of a misnomer too. Sometimes it can get really confusing. But the thing is that it also helps patch things like a Band-Aid. So cholesterol, this LDL, works like a Band-Aid, and when it sees something that needs to be fixed in a vessel, it goes and attaches and it goes and fixes that thing. But then when there's too much of it, it becomes challenging for the body to deal with if that HDL does not help get it back. So cholesterol is a soft fatty-like substance. It's waxy. It almost feels like a gelatinous, like, kind of like a Jell-O, or like if you've ever let fats, maybe like Crisco or something like that you've cooked, and how that can kind of harden, but it's still soft and waxy. That's what cholesterol is like in the bloodstream. Well, imagine that being really sticky in your blood vessels and in your blood, and then your blood is having to pump really hard to get where it needs to go, and you've got this sticky substance in there slowing things down. That's really the challenge. So cholesterol is normal and it's healthy and it's necessary. You don't want to not have cholesterol. You wouldn't be able to function. You wouldn't live without cholesterol. So meats, dairy products, eggs, things like that will have cholesterol. So one of the easiest things is for them to tell you, oh, well, you need to stop consuming so much cholesterol. And that's well and good and probably true. But your bigger next question needs to be, why do you think my liver is making so much cholesterol? Is there an inflammation problem? Is there something else going on? It's easier to tell you to stop eating eggs than it is for you to figure out why the liver is upset and making too much cholesterol. And that's very true of my situation. I am like, I just went to the doctor yesterday at Vanderbilt Hospital, Vanderbilt Medical Center, and I'm using this example because this is very rare. So I'm not using this to say that this is true for you, but for me, my cholesterol was high because I was overweight by about 100 pounds. I was having high blood pressure. I was having a lot of stress. So there's not just one thing here. And I ended up getting diagnosed with a liver tumor and adrenal tumor. The tumor was on both my adrenal gland, which sits on top of the kidney, and that's very close to the liver. And so the tumor grew into the liver, is what they're supposing. Now, that is very, very rare. There are only, I was told at UAB, less than 700 cases of like mine that they know of in the literature. So only 700 that they have documented. And the doctor that I saw at Vanderbilt yesterday as a follow-up actually said that that he could confirm that he would say at least less than 750 because of the rarity of my tumor. There's a lot of unknowns with that. So I'm having a lot of follow-up, and I'm getting to learn so much on this side as a patient. So what I would say to that is there's always probably something going on. Now, it could be simple as you're consuming too much sugar. Like, one of my favorite drinks is a large Chick-fil-A Coke. I think there's 65 grams of sugar in that. And like a venti drink at Starbucks, like a refresher, which I love. I love sugar and I love carbs, y'all. Um, they're not the healthiest thing for you, but I love them. I love those kinds of treats, and I love to drink my calories in that way. I can eat healthy all day long, but I love a good sugary drink. And so I started looking at that sugar consumption several years ago and was just astounded at how much sugar was in them. And I think a large, refresher venti Trenta is around 65 grams of sugar too. That is more than you're supposed to consume for the entire day. It's almost double what you're supposed to consume as a female. And so in looking at that, that would be a very easy reason to look at why the liver would be having trouble with inflammation, because when you have too much sugar on board, the sugar makes that blood thick. It makes it viscous. So then it makes it really difficult for the blood to get where it's going. So the pressure goes up. When your pressure goes up, it's kind of like that hose pipe that gets angry. It sometimes will rupture and split if you turn it on and the hose pipe is too fragile. It'll split and you have to, tape it or go get something new. Well, That's how our bodies are. And so your body will start to be inflamed if you add on extra pounds and stress and like that kind of standard American lifestyle and diet. So I say that to say it may not be that you have this super rare tumor like I happen to have. It might just be that we're consuming too much sugar, or we've got too much that is going on in our life. We have a lot of stress, or it may be that we have a sensitivity to something and we don't know it. One of the sensitivities that I would always point to is look at how much gluten you're consuming. A lot of people have a sensitivity to gluten that don't have a true allergy. They're not gluten intolerant. They don't have, celiac disease or something like that, but they just may have a sensitivity to gluten. That's very, very common. Gluten today has a lot of hybridization in it that it didn't have 100 years ago, 150 years ago. And our body sometimes will see that, and it looks very similar to antibodies and to molecules and cells and things in our body that looks like um, our thyroid and some of our other endocrine glands. And so when we consume that gluten in the US specifically, because of the way our grains are grown and hybridized, then our body can sometimes attack that because it looks like a very similar body component, but it doesn't look like ours. So our bodies can sometimes attack those. That's really violent language, guys, but it can kind of attack those because it thinks that it's a thyroid, component from some other human person. It looks too close to the human body's components. And so sometimes our immune systems will go and attack that. Our immune systems raise and lower throughout our lives because for women who become pregnant, their bodies will actually lower or dampen their immune system to be able to house a baby that's not completely theirs. That's why it's likely that you get a little bit sicker, or stay sicker longer, or just feel sometimes run down when you're pregnant. Of course, that's not true for everybody, but it's because your immune system is kind of dampened a little bit to be able to, sustain that life and to keep that baby healthy because that baby isn't 100% your DNA. So I hope that helps kind of bring it together. I know that was a little bit of a side quest, but I think having the context in this way helps you understand it. So cholesterol is not bad, it's necessary. It's going to help with all of these different components of being healthy, of making hormones, of synthesizing the vitamin D, all of that good stuff. And also, you have to think about triglycerides, which are stored fats. So, with the stored fats, you want to make sure that when you're looking at your labels on your food that you have zero trans fats, because those trans fats that you see on the label get stored like fats in your body, but they're actually chemicals. But instead of saying that they're human-made chemicals, it's much more fun to say that they're trans fats, but those are the chemicals and preservatives in your foods. And so you want to see that that is zero on the packages of the foods that you buy. And so this is just an illustration of what I was talking about with the liver making the cholesterol as LDL. The LDL goes out, carries cholesterol to the cells to try to patch them. When that doesn't have enough HDL to help take the excess cholesterol back to the liver to recycle, like Pac-Man, then it gets deposited as this little plaque here, which looks like a little pimple or a little zit. And when that blood pressure gets too much, when that artery or blood vessel gets too fragile, that plaque will pop and will sometimes rupture the artery or rupture the vessel. And then that's when you have a cardiovascular event, whether it's heart or stroke or something else, or blood clot, for example. So triglycerides are that type of fat that gets stored in the body. Again, this is things that you're actually consuming, you're eating. So butters, oils, and other fats. But healthy fats are needed because the brain is mainly made up of fat. So if you're low fat everything and you have brain fog, that makes total sense. I think we lived the 90s and the early 2000s in brain fog because all the women were told that they needed to be low fat everything. Well, low fat, when you take the fat out, then a lot of chemicals get added. So the brain fog comes from these extra chemicals that are on board, and now your body doesn't have enough fat to make your brain healthy, to make it function well. So I'm not a fan of low fat in terms of low fat as a product. You just need to be mindful of what you're consuming, and you're not going to go get those 100 calorie pack snack foods. That's not great. Try to shop the perimeter of the grocery store with the fresh fruits and vegetables and even the healthy frozen items that you can get. because the thing is that if it's got a package and it's got a label, it has been fairly processed and altered. So if it has a nutrition label, that's a real big clue. Hey, do I really want to eat this? Now, there are things that I'm like, absolutely yes, to make my life happy, I'm going to eat this packaged product. But I also do it really consciously and I make it a choice. Um, but you notice you don't have a nutrition label when you go pick up an apple in the produce section. So that's a good way to kind of think about eating. So now, we have made fat the problem for a really long time, but our body needs it as energy. And so the thing is that our body likes to store it because we've come from a long line of like famines and places in time where, you couldn't just go to Publix or the Target or the Walmart or wherever and Kroger, Aldi. You couldn't just go to the local grocery store and get your food. You had to hunt, you had to gather, you had to store it. And so our bodies are used to, especially going into this cold season, our bodies historically are used to storing fat. So if you notice that you gain weight during the holidays, it's not just about the cookies that you have or the pies that you have at Thanksgiving. It's that your body also naturally stores more fat to protect you, to insulate you, to get you through a winter where there might not be a lot of food available. And so yes, it probably is the Christmas cookies for me, but also there is a biological evolutionary point of that as well. And then you shed your fat kind of through the winter months, like through the summer months, excuse me, and then kind of gear back again. So the thing is you just want to make sure that as you do that kind of 5 to 10 to maybe even 15-pound weight gain, that you're losing it during the active summer months, and then you're not, gaining 15 and then another 15 the next year, which sometimes happens. So these are the normal levels for triglyceride. We like to see that it's less than 150. Just know that these numbers vary based on the labs. So like a lab is going to tell you how they're calculated. So if you go to LabCorp or you go to the hospital here, that might look different if you go to a hospital in Birmingham and they do their own in-house labs because they titrate that based on what their lab values can test. So these are just general numbers. Again, if you're over 150, you're going to be borderline high and they might recommend medications for you. If you're over 150, you're at a greater risk for metabolic syndrome, which is you're most likely obese, that you have high blood pressure, high cholesterol, high triglycerides, high blood sugar. That is metabolic syndrome. So trans fats are naturally occurring and artificial food preservatives. So things that are in fried, baked, and processed foods, and it triggers the liver to make excess cholesterol. So if you're eating a lot of processed foods, that's another reason. It may not be high in sugar, but it's highly processed. So that is the red light. I like to use a stoplight as an indicator because I think that's really helpful in getting people to understand. Okay, so trans fats are a red light item, like try to avoid. Yellow or saturated fats, these are sometimes things. So animal fats, full fat dairy, they also trigger the liver to make excess cholesterol, but they're okay in moderation. And for me, I would rather see you eat the real thing in moderation than something that is altered. So I would rather, for me personally, I'm going to have me and my family, the people that I'm responsible for in my household, are going to eat real butter. They are not going to eat margarine or some kind of butter substitute. Or some kind of sugar substitute. We're going to use the real thing in moderation. And that may not be real sugar, right? That might be like monk fruit, or it might be honey, but it's not going to be, aspartame or, stevia for us, right? So a lot of people have reactions to stevia and don't even know it. It's really touted as being very healthy, but a lot of people have super bad headaches with stevia and don't attribute it to that. Because usually when you're going to get something that has stevia in it, like, a lemonade from our favorite local restaurant that I frequent, you're already pretty tired. And so you're just thinking you have a headache and you're tired because that is just how it is that day, not realizing that every time you get that stevia drink that you are also getting a really bad headache with it. So just kind of keep that in mind with sugar substitutes. That's very common. And also the body doesn't always recognize how to process those sugar substitutes. So saturated fats, healthy fats, things like salmon, things like avocados are really good. Almonds, walnuts, olive oil, flaxseed. A lot of times our food looks like the organ that it helps. So like walnuts is an example of a great brain health food, and walnuts kind of look like a brain. So if y'all want to go down a rabbit trail this afternoon, y'all go Google that. There's a lot of graphics on that. It's kind of fun. Not super scientific, so I didn't include it here, but fun
Hey, Abby,
nonetheless.
before
Yeah.
we go move on, there's a question on which milk do you buy?
I do whole milk. Now, you're not going to hear of a registered dietitian nutritionist probably recommend that for most people, but I do a whole milk. I like Fairlife milk. It's a little pricier, but especially like for growing brains and bodies like my kids, they need to be able to have that fat. And now I grew up on skim milk and it was very watered down. I had never had whole milk until I was an adult. I kid you not. I will testify to that. I only ever had skim milk and I was not a healthy child. My children are very healthy and they've always had whole milk and I like Fairlife, but that's just me. It's not like the best or anything. I just think it's a good option. Try to get organic with milk if you can. It's not always affordable. There are 7 people in my house, and we went through 3 and 4 gallons of milk at a time when the kids were really little. So I know that's not a super economical option, but milk is one of those things, if you can get organic, it's best. Did that help, Miranda?
Yes, and then to follow up with that one, it was what do you recommend if you're lactose intolerant? Which milk do you recommend?
Yeah, I think that there are a lot of good choices. There you can take the Lactaid and drink regular milk. My mom is lactose intolerant. That is really common, especially for women as you age. So she was not until postmenopausal, she was not lactose intolerant. And then apparently that is something that they're seeing more of as a trend now. And so she is able to eat normally with taking her Lactaid. So that could be a possibility. Talk to your healthcare provider. If not, I would say some of the milk, like things like almond milk, oat milk, things like that, they all have their pros and cons. I would say that oat milk is what I see recommended most often. Almond milk is it's very expensive. It's also highly processed. Almond milk was a favorite for a long time. It also has a huge environmental burden, if that's something that you care about. So almond milk is usually not the go-to, although 5 years ago it would have been the one everyone recommended. But I think that that's such a personal choice, and there's no right or wrong on that one. It's just what do you tolerate? Also, like if you're putting it in your coffee, using an almond milk versus an oat milk, that's going to taste very different. So a lot of people have very different types of milk based on what they're using. I hope that helps. That was not the best answer. You can let me know, Miranda, if they say something else.
Yeah, you're
Um,
you're good. There are
okay,
a few other
perfect.
questions, but we can answer those at the end.
Okay, perfect. So, adults should be screened every 1 to 5 years based on their heart disease risk factors. And there's a little formula that I put here that you wouldn't need to know, but I think it's helpful to know just overall. Like your total cholesterol equals your LDL plus your HDL plus your triglycerides divided by 5. So, really, when someone tells you that your total cholesterol is too high, that is not as important and helpful to a clinician as it is for you to know what your LDL, HDL, triglycerides are separately. Because if your HDL is really high, and I have seen people who've come in to like a Wellbama screening that have over 100 HDL, and I'm like, what do you eat? And I always ask them when I would see high numbers because a lot of people are their HDL is in the 30s, 40s, and 50s. Mine is in the 40s. Um, and the thing is that you want it to be above 60. And so sometimes I think it's just good genes, or we haven't figured out what helps the HDL the most because it's really easier, I think, to lower your LDL than it is to raise your HDL, which can be very frustrating for some people. So your total cholesterol could be high just because your HDL is so high, and you wouldn't want to lower that. So if it's 100, you don't want it to be closer to 60. You want to keep it right where it is. So the thing is your total cholesterol, it could look like your high cholesterol. And I've actually seen where people have been recommended to take cholesterol lowering medications like statins, and their numbers individually were perfect. It was just that their HDL was too high. So you want to ask the individual numbers, not just the total. So ideal cholesterol would be less than 200 overall. Your HDL would be your LDL would be less than 100, your HDL would be greater than 60, and your triglycerides would be less than 150. So these are your ideal numbers, borderline and too high. At too high, they're definitely going to be telling you to take medications. Most likely, they're going to do that on borderline as well. So there is a component to like your age and whether you're male or female based on hormones. That is the only reason they ask about that. But these are the ideal numbers for people over 20. So the downside of excess cholesterol, and these are all of the fancy medical words, but the high cholesterol then can make you have hardened arteries, which is the atherosclerosis, which can lead to heart disease, which can lead to heart attack or stroke. And so, as I mentioned before, there are no symptoms of high cholesterol. So that's why it's so important to test that. That's why it's so great to come to Wellbema and get that benefit of having your numbers and knowing whether or not you're at risk for those things. You can catch things really early on. So heart attack, stroke, poor circulation, high blood pressure, all cardiovascular health concerns. This is another image that shows a normal artery in air quotes, and then the initial stage of the atherosclerosis, that's kind of the hardening and the plaque buildup that you see. And you'll notice that at the complete blockage, that's only about 70% occluded. But at 70% to 80% occluded, that's considered a complete blockage because of how symptomatic that you would be. And I think that's always something that's eye-opening for people. So inflammation, when the cholesterol is high and it's in excess in the bloodstream, like you can see here in the yellow, that's the cholesterol. This will trigger that inflammatory response that we talked about. And then you're going to have more things sent to that area of the body. Things that are activated by the immune system. So thinking about like white blood cells, cytokines, all of these things get activated and go out to the body depending on where it is. And so it's really important to know, like, you might feel really drained or fatigued. It's because your body's having to work overtime. Your immune system has been activated. And that's why chronic inflammation can be so damaging to our bodies. So these are some other things that will warn you of clogged arteries. We say that sometimes clogged instead of, saying things like having plaques. But I mentioned strokes. The fatigue and dizziness is really important because you're not getting enough oxygen or blood perfusion sometimes to the brain and to the other vital organs. Shortness of breath, chest pain, lower back pain, erectile dysfunction for men, and then kind of that neuropathy, the painful, numb, cold hands and feet because you're not getting enough blood flow. When your body recognizes, hey, I'm not getting enough oxygen, enough blood flow, they're going to shunt all of the blood, meaning kind of, really aggressively send blood to the core, to your organs, to your brain. And so then your hands and feet are going to be colder. And that's going to cause vasoconstriction and pain. So blood pressure, we mentioned what that is. And so it's really important that you build in exercise, gentle movement like walking, meditation, brain breaks, things like that to be able to lower these blood pressure readings for you. More than 3 high blood pressure readings are going to probably get you a diagnosis of hypertension and usually a prescription for a medication like hydrochlorothiazide or HCTZ. HCTZ is one of the more common ones to prescribe. It's kind of a first defense for a lot of people. And that's what I was on for 4 years. I say that because I was able to lose weight and wean off. And when I told the endocrinologist at Vanderbilt yesterday, he said, you were able to lose almost 100 pounds unassisted before I started a GLP-1. And I said, yes. And he was like, how were you able to do that with all of the things going on? I said, it was very much white knuckling it. Like I was counting grains of rice to be able to lose that kind of weight. And he was like, that's pretty unheard of. And so we kind of talked about that. But the thing is it's unheard of because once your inflammation gets up, it's really hard to cut that inflammation down. But it was things like diet, exercise, knowing my macros, my proteins, my healthy fats, my fiber. It was drinking water with electrolytes. So I was doubling my water intake because I was drinking very little water. it was meditation. It was, wearing blue light blockers at night, glasses, so that I was preventing the blue light from the screens to kind of, overtake my circadian rhythm. It was journaling. It was going to counseling to manage some of my stress. Um, it was, having systems and routines in place so that I wasn't living kind of in survival mode. I used to joke and say I was living with my hair on fire because that's what it felt like. So I was being really proactive in those things. There were so many things that I overhauled that had nothing to do with your standard calories in, calories out to be able to lose the weight, because it truly was a lifestyle inflammation issue for me. So I was able to wean off that with medical supervision. And I tell you that because you don't hear people coming off high blood pressure medication after having to take it for 4 years. That's pretty unheard of. So if you're on a medication like that, always talk to your provider. They don't usually tell you that you're going to be able to wean off or that you're going to be able to do these things, because most people can't sustain the lifestyle habits needed to be able to do that. And I would have told you 10 years ago that I wasn't going to be able to do it. But with a lot of the changes I've made in my habits, in my lifestyle, I was able to sustain that. And so when I went yesterday, my blood pressure was 108/72. And so that was pretty remarkable for someone that, 5 or 6 years ago was morbidly obese and had stroke level blood pressures. And I actually eat more food now than I did then because I was so heavily calorie restricting that I was really overweight but malnourished. And so I think that's true of a lot of people that I see and work with, and my patients and my clients. So, it's not about that you're eating too much sometimes. Sometimes it's about everything that's going on in your body. So I hope that's encouraging to somebody. Y'all can let us know in the chat. I like to tell stories because I think stories really make it come closer to home. Otherwise, it's just textbook stuff. So these are blood pressure readings. They like for your blood pressure to be less than 120/80. 120/80 18 years ago when I was in nursing school was ideal. Now, if it's 120/80, they're watching you for high blood pressure because they know that blood pressure spikes throughout the day. The minute that you get in traffic on the way home, your blood pressure goes up. And so if it's already at 120/80, then, you're spiking into the ranges that aren't okay, like the stage 1 hypertension. So even though people can feel pretty fatigued at a blood pressure like I'm maintaining, like I feel pretty fatigued at 108/72, 78. That's not a great blood pressure in terms of me because I have dysautonomia POTS. For other people, that would be more ideal because then if you do spike when you have a upsetting event, you've got a range to go. You're not in the orange and the red. So that's important to know. You're going to see people, even at 120/80, start to make comments about that. This graphic is just showing this in a little bit different format and with a little bit more information. And so y'all will have access to these slides. These are the symptoms of hypertension. There are a lot of symptoms for it to be silent. It is not so silent. It's just a matter of, do you put these symptoms together? So headache, shortness of breath, nosebleeds, feeling like your face is flushing, dizziness, chest pain, visual changes, fatigue, pounding in your chest, neck, or ears because the blood is rushing. Lots and lots of symptoms with hypertension. Like I said, 3 or more readings are going to be likely going to be a hypertension diagnosis. Everyone can have high blood sugar. It doesn't mean that you have diabetes. Everyone can have and does have high blood pressure. It doesn't mean that you have hypertension. And so I think that's important to note too. If you eat cake today, you're going to have high blood sugar. It doesn't mean you have diabetes as a diagnosis. If you have to avoid a wreck and slam on your brakes, you're probably going to have high blood pressure because you're going to activate your cortisol and adrenaline. So that's important to know. These are some other things that are related to high blood pressure. Just a graphic, I think, helps explain it for some folks better. And then, of course, we know the impact of hypertension is pretty severe. 1 in 3 adults in the U.S. have hypertension. So that's important, or have blood pressures that are concerning enough to be considered hypertension. And about half only are controlled. So of the people that have hypertension, only about half of those folks actually are controlled on a medication. And then 1 in 3 have pre-hypertension, so in that yellow zone. These are some other risk factors. The things that are in red, you really can't change, but the other things that are in black, you can. So your stress, your smoking, your substance use, your weight to some degree. It's really hard to control sometimes, but your weight, your diet, your salt intake, your caffeine, and other lifestyle choices. So medications, there are a lot of medications that can help treat hypertension. That's going to be very, very personalized because there are so many medications for hypertension. And then diabetes, of course, there's lots of complications that can come with that. So catching that early is really helpful. This is a graphic on the metabolic syndrome. And then this kind of gives you an idea of all of the things that we talked about today. And then this is a holistic toolkit. So this is where you can really kind of dive in. So I'm going to just move through this quickly because I have class to teach at 1 o'clock. But I'm going to move through this because I just want you to see it. I want you to be able to see the things that you can kind of grab onto. So this is all about control and focus. Putting your attention, your time, your effort, your energy into the things that you can control, and the things that you can't, you have to let it go. I made this graphic for y'all, but I made it more so for me because I try to control a lot. And that's just not really realistic. So think about the things that you can control, where that aligns in this Venn diagram, the last one, the things that matter and where they overlap with the things that you control. Focus your time and attention and energy and effort there, your money there, because there's a lot that you can control that don't matter, that doesn't matter, and a lot that you feel like it matters to you, but you can't control it. So these are some 7 steps to a healthier heart. All of the things that we've mentioned basically today. The Wellness Basics, we have a class on our YouTube channel at wellness.ua.edu, and it goes through sleep, hydration, how you eat, how you move, and how you meditate. And that can look like brain breaks, listening to music, going outside and walking. It doesn't have to be your standard sit crisscross applesauce and meditate, although that's really good for you. The GLAD technique, so doing this at the end of your day, like what's something you learned? Hopefully you learned something today from me. Something you're grateful for, something you accomplished today, something that delighted you today. Practical tips, and again, you just use this like a menu, what works for you. And then all of the other good information about diet, lifestyle, reading a nutrition label. We sometimes only look at the calories. We don't look at the actual label for anything else. Stress management, and then some other resources. And so this is a quote by Arthur Ashe, the famous tennis player. Start where you are, use what you have, and do what you can. Don't let it get overwhelming. We'd love for you to follow us on our social media. And now I will take questions.